Are you ever giving patients with simple cellulitis anti-inflammatory medications as adjunct therapy? Obviously, cellulitis is a bacterial infection of the skin. We need to give the patients antibiotics, but there is a localized inflammatory response, and there is some data showing us that anti-inflammatories can hasten improvement of that cellulitis. Prior consensus guidelines said that you could use steroids in this circumstance, but that was based on pretty weak data. Now we have a systematic review and meta-analysis looking at non-steroidal anti-inflammatories, and the data shows that NSAIDs led to early improvement of that cellulitis in the first 3 days. This is important because we know that cellulitis, even with appropriate antibiotics, isn't going to improve in the first 2 to 3 days. In fact, you can see up to a 25% spread of that cellulitis in the first 48 hours. So if NSAIDs have a benefit, and we give that in addition to our antibiotics, we might actually help the patients to have an earlier improvement. We don't have perfect data, but the downsides are pretty low. So what I'm doing is that in patients with simple cellulitis who I'm sending home with antibiotics and they don't have any contraindications to NSAIDs, I'm giving them a short course, 4 to 5 days of NSAIDs in addition to that antibiotic therapy.